What does a face and neck lift address?
Great question. A face and neck lift, I've talked about this in the past, but when people say facelift or neck lift, it's like saying race car. That means a different thing to different people. So here at Guelph Facial Plastics, when we're doing a face and neck lift, that means lifting up the cheek, so the nasolabial fold, lifting up the jawline, and lifting up the neck so that you have an improved neck, submentum, jawline, jowl, marionette line, cheek, all that comes up. It does not include a brow lift or a blepharoplasty or a lip lift, but it's just the cheeks and the jaw and the neck. And the reason why is because this muscle here, the platysma, is continuous with your SMAS. And in the face and neck lift, I'm elevating the SMAS and the platysma and repositioning the whole thing. So the whole thing comes back up.
Do you perform standalone facelifts or standalone neck lifts?
Yes. So a standalone facelift, again, here, I would call that a mid facelift. So if we just wanted to lift the face, that's the mid face here, we would make an incision that's just like that and just lift this area. You still release the ligament, it's still deep plane, and you can do that. For the neck, the answer is yes, sometimes. If you're a younger person that has a very blunt cervical mental angle, but not a lot of extra skin, we can make a little incision underneath here and contour the muscle, the fat, and the gland and give you a neck lift through a cementoplasty. And rarely is somebody a candidate for a short scar around the ear and back where we just lift the neck. When most people call in and say, I just want a neck lift, not a facelift, they're not a candidate because they have hanging cheeks, marionette lines, and jowls. And if I just do this, the neck will mismatch the face. And again, I talked about this in the past about thinking of a curtain. If a curtain is falling off the curtain rod and it's kind of piling up on the floor, you don't cut the bottom of the curtain off, you lift it from the top. And so with a facelift, you're lifting things back up because it's falling from up top.
What are other common procedures patients do with their face and neck lift?
There are a number of things that we commonly, probably the most common thing would be CO2 laser resurfacing. So what a face and neck lift cannot do is make your skin healthier. And so I can reposition and lift lax skin and fat pads and muscle and make the contours look better. But if you have thin, crepey skin or skin that's sun damaged or skin that has brown spots and wrinkles, a facelift doesn't get rid of your wrinkles. It gets rid of folds and hanging skin. But when we lift that up, if it's still thin, we can laser it and that can increase the collagen. It can take away the surface discoloration. It can help with fine lines. And so probably the most common thing is the CO2 laser resurfacing. We also do a lot of blepharoplasty and brow lifts. Probably brow lift is number 2, because if you lift all of this up and the brow is low, you get this weird kind of line and wrinkle here. So if this is all dropped and we lift all this up, we often will lift up the brow with it, and that makes everything look smooth. It rejuvenates the eye. And somebody that needs a brow lift almost always needs a little upper blepharoplasty as well. So they kind of go hand in hand. And then often a lip lift with an aging face procedure, because the lip elongates with the rest of your face when you age. And so a small little incision under the nose to lift up the lip in concert with everything else will keep everything in balance.
Where will the incisions be made if I have a face and neck lift?
For most people, that incision will be right inside the hairline, the temporal hairline here. If you look at the level of your eyebrow and then travel back to your hairline, it would start at the level of the eyebrow, come down and around, and then down in front of your ear. For most women, I go behind the tragus. For a man, I go in front of the tragus. And after the tragus, it comes down around the earlobe, comes up in the crease, and then goes across and then down the hairline.
How long does a face and neck lift last?
Great question. And again, it's a depends kind of answer because it depends what you're asking about what lasts. So if I can reposition the SMAS and get the jawline tighter and the neckline tighter and the nasolabial folds all elevated, that lasts years, if not decades. But what doesn't last is skin health. So if you are the kind of person that's a golfer or a sailor or spends their summers on the beach, their winters on the beach in Florida, and you get sun damage to your skin, it will age it faster, it'll get thin, it'll get wrinkly, and you may have a great jaw and neckline and aged looking skin. And so if you invest in your skin after you invest in a facelift, it should last you decades. If you don't, then you'll age faster because of those factors.